with this, or you can just say, you know what, we're just going to do this, you know. So again, it's entirely up to you how you set those things up. So again, we're going back to where we started. So really what we want with this is a monthly treatment. And I say monthly because what happens when you create an injury is that, as we mentioned earlier, you get all the cytokines and the fibroblast activity, which is called a chemical cascade. So that starts to rise. Now, theoretically, they say, okay, you don't really need to injure again until that rise starts to stop. And that's around about 28 days. So that's why we stick to a monthly treatment. Then it also comes to economics as well. You know, so, you know, patients that can afford $300 a month or every 2 weeks, great, that's one type, or others are going to say, you know what, $300 a month is all I want to spend, you know. So it kind of fits into that category. You can do more, but most people stick to the month because of that chemical cascade part of it. So as we mentioned in the beginning, we have a lot of different solutions. So you say, okay, when do I use what? And so obviously Rejuvenate, which is a peptide based, so there's 5 different peptides in there. So obviously that's for your collagen and elastin. Then we have an HA, which is for hydration. The pigment, which is the kojic acid, which is the lightened one, and then the growth factor. So those are our most popular. But as I mentioned earlier, we do have all of the others as well. So say for example, you had somebody with some pigment issues and you just happen to use Rejuvenate. Are you going to see a pigment change? Yes, you are, because the needling helps pigment change as well. So because a lot of these skin anomalies aren't just one thing, right? So there are a number of things. So whether it be collagen, elastin, and pigment. So okay, what do we do? So if originally you're booking a 6 treatment package or something like that, then you can say, okay, well, I'm going to do 5 Rejuvenate, 1 lighten, or whatever, you know. Or you can say, you know what, I'm going to do 3 hydrate and 4 Rejuvenate, you know. So there is some HA in the Rejuvenate as well. But obviously, if you have someone it's pretty much everyone's dehydrated. So the hydration is always good, and always one that I recommend. Again, when it comes to age, so somebody that's younger is obviously going to have more active growth factors than somebody that's older, right? So if somebody comes in for just general anti-aging type of treatment, and you're going to use the peptides. So if they're all younger than 50, then peptides are great. If they're older than that, maybe the growth factor is better. So again, it's going to depend on your cells and how you position that, but also the growth factor is more expensive. So again, that's entirely up to you guys. But usually elderly, you're better off with the growth factor than you are with the others. But again, that's entirely how you want to position everything and what your patient population wants, you know, the usual things like that. I have some med spas that use nothing but growth factor. It doesn't even use anything else.
Wow.
You know? So as an example. So again, you can mix and match the way you want. Within a series of treatments, you can mix and match the way you want. Obviously, on the same day, you're going to stick with one. You know, so that's the way that works. So say for example, we say, okay, Mrs. Jones here, we're going to do a Rejuvenate. So this is a Rejuvenate, and on here is a purple 250. So basically that means that inside this box is a purple needle tip that is 250 microns, so 0.25 millimeters. If you see green here with 500, then that's the 500, so that's a 0.5, okay? So in each one of these are treatment specific, so this would be for one treatment. And in here you have a cartridge of fluid, if you like. And then you have the needle tip here. So this is for one individual treatment, and again they're all going to be the same. So the hydrate would be exactly the same, except inside here would be the hydrate solution, as an example. The only one that's different is the growth factor, and so the growth factor inside this box will be an empty one of these cartridges with a needle tip, but then also a vial of growth factor. So then you're just going to pour the growth factor in here, put the little stopper on, and you're ready to go. So basically, other than that, they're all the same. So again, the 250 and 500. So if you look at this needle tip here is purple, and then obviously the 500 is going to be green. So you know.
I'm gonna pass it around so you see.
Now with that, you'll notice there's no needles exposed.
Yeah.
Because you're actually going to suck.
It's like a wheel of needles.
Yeah. So you're actually going to suck the skin up to the needle as opposed to pushing a needle down. So that's why there's no needles exposed here, because they're inside this little hole here. So basically what's going to happen is the skin's going to come up here, you get a needle, and then it's going to drop down. So the other thing is too, what happens because of solution and the way the skin works is when it collapses, it acts like a suction, right? So the skin sucks fluid with it. So that's why you're going to get the delivery of the solution as well. So basically what I can do now is just run through the machine a little bit, and then do you guys want to do treatments as well? Is
Yep.
that okay? Perfect. Okay.